Hi, Dr. Lauren here. This is about post-menopausal bleeding, so bleeding after the menopause. So the menopause is a retrospective diagnosis because it's essentially when a woman over the age of 45 has not had periods for greater than a year. So if you are over the age of 45, you've had a full year of no periods, you would be considered post-menopausal. If you then had any bleeding of any description, it needs to be checked out. And that is even if it only happens once, even if it was only a small amount of blood, a bit of spotting, or a bit of bloody discharge, or there was no other symptoms, or even if you're not sure it was bleeding, it should be checked out. So if you go to see your GP, you would be referred to a specialist clinic for postmenopausal bleeding within 2 weeks. When you attended that clinic, they would almost certainly examine you. They would possibly do an ultrasound scan, and they may do something called a hysteroscopy, which is essentially passing a very small camera through into the vagina, through the cervix, to look into the womb, the inside of the uterus. And they may take a biopsy or a small sample there. So what can cause postmenopausal bleeding? So the more common causes are things like atrophic vaginitis or endometrial atrophy, which is basically when your hormone levels have dropped lower, i.e. the estrogen levels have dropped lower. You can get thinning of the skin of the inside of the vagina, and the inner layer of the uterus, the endometrium, kind of shrivels up as well, and this can sometimes cause some bleeding. You may have some polyps on the, and a polyp is a kind of benign growth on the cervix or on the uterus or womb. You may have something called endometrial hyperplasia, which is basically when the cells of the endometrium, so the inside of the uterus, are growing, increasing in number. So there's a build-up of the endometrium, and this can happen because of increase in estrogen. It's more likely in people who are of higher weight. And the reason why that diagnosis wants to be made is there is potential for that increase in the cells to turn cancerous. So less common causes for postmenopausal bleeding, but obviously the ones that want to be found early if they're there are cancers of the ovary or the womb or uterus. So the treatment will depend on what's causing the bleeding. So this might be estrogen replacement in the example of atrophic vaginitis. It may be removing a polyp on the cervix if it's there. It may be introducing an IUS, which is a hormone coil to help with release of hormone locally. It may be that you're advised to have a hysterectomy, so removal of the uterus if there's a lot of overgrowth of cells there. And obviously if there is a cancer of some description, then a hysterectomy may well be advised, and indeed removal of the ovaries as well if they were involved. So the point that I want to get across from this video is that the vast majority of people who are sent to the postmenopausal clinic have a benign reason for their bleeding, and it's either not requiring treatment or very readily treatable. But there are a small proportion for whom it may signify something more serious. So please do take it seriously if you have any bleeding after the menopause, even if it's just once. Please go and see your GP.